Is bread off the menu if you have type 2 diabetes? Not necessarily, but the type of bread you choose really does matter. For millions of people in the UK living with type 2 diabetes, managing blood sugar levels is a daily priority. And since bread is such a staple part of the British diet, knowing which varieties work better for you can make a real difference to your glucose control. So let's look at what the evidence actually says. All bread contains carbohydrates. When you eat carbohydrates, your body breaks them down into glucose, which then enters your bloodstream. The key question is how quickly that happens, because a rapid rise in blood sugar after eating is something people with type 2 diabetes need to be mindful of. This is where the glycemic index, or GI, comes in. It ranks foods by how quickly they raise blood glucose. High GI foods cause sharper, faster spikes. Lower GI foods produce a more gradual rise. White bread tends to sit at the higher end of that scale. Whole grain, wholemeal, seeded, and rye breads generally produce a slower, more gradual rise in blood glucose, largely because they contain more fibre, which slows digestion and glucose absorption. One thing worth knowing, GI values can vary depending on the brand and recipe, and GI isn't shown on UK food labels, so it's not always easy to use as a guide in the supermarket aisle. A more practical approach is to read the nutrition label. Look for breads with at least 5 to 6 grams of fibre per 100 grams and check for minimal added sugars. It's also worth checking the ingredients list. If wholemeal or whole grain flour appears first, that's generally a good sign. And watch out for the term multigrain. It sounds healthy, but it doesn't actually guarantee the bread is whole grain. Always check the ingredients and fibre content to be sure. While you're checking the label, it's also worth glancing at the salt content. People with type 2 diabetes have an increased risk of cardiovascular problems, so choosing a lower salt option where possible is a sensible habit. Breads to be more cautious with include white bread, bagels, and soft white rolls. These tend to be lower in fibre and can cause more rapid rises in blood sugar. What about gluten-free bread? Unless you have celiac disease or a diagnosed gluten sensitivity, gluten-free bread offers no specific benefit for managing type 2 diabetes. In fact, many gluten-free varieties are actually lower in fibre than their whole grain counterparts. Now, portion size matters just as much as bread type. Even a lower GI bread will affect your blood sugar if you eat a large amount of it. Pairing your bread with a source of protein like eggs or nut butter and healthy fats can also help to slow glucose absorption further. It's also worth remembering that individual responses to bread can vary. Some people find sourdough or rye bread suits them particularly well, though the evidence on this varies and it's not a one-size-fits-all situation. NICE guidelines are clear that dietary advice for people with type 2 diabetes should be individualized. So if you're unsure about how bread fits into your diet, it's really worth speaking to your GP, diabetes nurse, or a registered dietitian who can give you guidance tailored to your specific situation. To recap, whole grain, wholemeal, seeded, and rye breads are generally better choices than refined white bread. Check labels for higher fibre, lower sugar, and lower salt. Don't be misled by multigrain. Look at the ingredients. And pairing bread with protein and healthy fats can help keep blood sugar levels more stable. As always, nothing in this video replaces personalised advice from your healthcare team. They're best placed to support you with your individual needs. Have you found a particular type of bread that works well for you? Let us know in the comments. We'd love to hear from you. And if you found this helpful, please give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content.